Good evening and hello everybody out there. This is Dr. Solomon with Your Health Today on My Prime Media. Today is Saturday, the 19th. We have a very interesting show today and a lot of information to share with you. But first, let me start with some of the questions that we had no time to cover the last Saturday. And I thank you for all the support messages that I received from you, and I really appreciate your appreciation. Now, this question here says, I have a worry. I saw my last menses on the 29th of June till the 1st of July. So the question is, when is the first day of the menses? The 29th of June. And if I want to calculate ovulation, like we said the last session, then day number 1 is the 29th of June. Now, my cycle length is 27 days. I don't care. 27, 29, 100, 200, I don't care. As long as we calculate day 1 of the menses as day 1. And then we add 13 more days, meaning day 1, 2, 3, 4, 5, 6, till we reach 14. And that will be my ovulation day. Her ovulation day. So now the question is, and of course, all the information I share about the patients are consented, meaning they have given me informed consent and fully agreed to use the material as an educative purposes. So if I made a mistake, and this is very nice of them, because if I make a mistake or something happened to me, I would like to share it with somebody else so the same thing or the same mistake is not repeated and learn to be lessened from what had happened to other people. And this is really, I really thank them, and everybody out there should be very thankful to all those patients that are sharing their files with us today. Now the question continue. So her first day of the menses is the 29th of June until the 1st of July. Okay, so now my cycle is 27 days, and we said this is irrelevant. The length of the cycle is irrelevant when it comes to counting your ovulation day. I had sex with guy number 1. So obviously there is number 2. I had sex with guy number 1 on the 4th and the 5th of July. All right. So let's calculate. 29, 30. 29 and 30. 1, 2, 3, 4, 5, 6, 7, 8. 9, 10, 11, 12, 13, and 14. That we're talking about 14th of July is her ovulation day. So she had sex with the first guy on the 4th and 5th of July. And then she had sex with another guy, that's guy number 2, on 10th, 12, and 14. So she hit the pot. 14th was her ovulation day, and she had sex with the second guy on the 14th of July. So, and I'm now pregnant. So who is the father of the baby? Guy number 1 or guy number 2? I guess we answered that already. That's guy number 2. If we know how to calculate the ovulation day, a lot of agony and a lot of effort and a lot of missing chances of getting pregnant is being solved, because there is a lot of misleading information out there and a lot of confusion about how to calculate your ovulation day. Now it's very easy to calculate. Again, day number 1 of the menses is your day 1 of counting, regardless of the length of the cycle, and then you go 14 days. When is the best time? When is your window of opportunity to conceive? Is the day of ovulation, which in this case, in this woman case, is the 14th of July, one day before, which is the 13th of July, and one day after, which is the 15th of July. She had sex on the 14th of July. The baby's father is guy number 2. Now, I'm not a judge of somebody's behavior, but there is a piece of information that I would like to share with you, with you all. And this is very recent data that has been released from some Japanese study. What they say, and this is true by the fact, has been confirmed. Okay, what they say not only that your brain have memory, your heart also have memory. Your heart also have memory. And guess what? What else? The uterus also have memory. Like this is finger, and this is we call a fingerprint. The sperms also have a fingerprint. No one sperm is similar to the other, no matter what. There is no two identical sperm from two different guys, even twins. Okay? So now, we said everything have a memory. The brain has a memory, the heart has a memory. I mean, the Japanese studies has shown that the uterus also have a memory. Memory for what? The uterus remember the genetic input, the fingerprint of that sperm. It remembers it, and it knows what guy is this. And now the uterus is programmed to this guy's sperms because it recognized its fingerprint. It recognized the genetic fingerprint of that sperm. And no two fingerprints are similar, meaning no sperm is similar to another sperm anywhere in the human race. They're not similar. And the funny thing is the uterus remember which sperm is this. So the woman remembers which man that, conceive with her or have intercourse with her. The uterus remember and is programmed for that. Now, when I change sperms by changing men, the uterus get confused. This is not what I was programmed for. In order for me to switch men, then, the study says, we have to stop sex with anybody for 3 months or so. Then the memory of the first guy is being erased. And now, upon intercourse with the new guy after 3 months, a new memory is installed. And then the uterus recognizes, now this is my new memory, and this is the sperms that I should be recognizing. Why I'm saying that? Because when you confuse the uterus, you welcome in a lot of diseases that we know about and diseases that yet we discover. Right? So this is how it is. So for you out there, what is the advice? What is the take-home message? Please, if you're going to have sex, ladies, have sex with one guy. Remember, the uterus have a memory. And remember that confusing the uterus with many sperms from many different guys, you are welcoming diseases that we know and diseases that we are yet to discover. So you want to be safe, play it safe. One guy at a time, separate. You want to have many guys, then is subsequent with break-in time of not less than 3 months. Okay? So I guess that answered the question because I promised her I will answer the question in the show. Now the second quote, good evening, doctor. Please, can a man with traces of inactive syphilis impregnate a woman? Let me tell you something about syphilis. Syphilis is stages. There is an early stage, and there is a contagious stage, and there is a late syphilis stage, okay? So there is no such a thing as inactive syphilis. The syphilis is there. It's just that the organism has went to the nerve ending and hide there. Anytime your immune system is suppressed, it shows up. And we're going to discuss a case, but with a different microbe, not syphilis today. So yes, a man with syphilis, there is no such a thing as an inactive. If you have syphilis and it has been confirmed by serology, then you must take the treatment. The treatment is very simple. It's just, one injection a week for 4 weeks and you're done. You're done. You finish, yeah. But it does not stop you from getting somebody's pregnant. All right. I cannot take calls, so send on me messages, okay, please. I was just following your program on the media. I got attention, so I got your WhatsApp, okay. Okay, now, so the bottom line is, I am a lady with 34 years old. I have 4 female children, and my little worry is if it's possible to do some follow-up to have a male. So she has how many? She has 4 females, and now she wants a male. And I also received a similar question before coming to the show also about the same thing, but this one she wants a female. So here, the question is, what can I do, basically, they're asking, what can I do to have a male or a female? That is about 3 or 4 questions touching the same topic. What can I do to have a male? What can I do to have a female? There is nothing you can do. Why? We're going to explain why there is nothing you can do. You can rely on statistical values and taking the highest chance, the highest probability of getting a male or a female, but there is nothing in your hand. Let me explain something to you. It was played on a video also the last time we played, the last session we played the video. Maybe some of you guys did not pay attention because maybe the medical terms were a bit complicated or not easy to understand, but I'll make it as simple as possible. Any female carry an X chromosome, one X, okay? That is the sex chromosomes. The male carry either Y or X. So we have sperms that carry in the Y. We have sperms that carry in the X. If the Y chromosomes win the race and fertilize the X chromosome egg, then we have a YX. Then that is a male. If the X chromosome win the race and fertilize the eggs, then we have an XX. That is a female. So the female has nothing to do with having male or a female. It's all about the sperms that belongs to the man. So it's the man who decide male or female. But can the man control his sperms? I want this time male, I want this time female? No. He doesn't know himself. But what you can do, if you're only interested in females, if you're going to get engaged with somebody or attached to somebody that you're planning to have babies with, the only thing really you can do is, to find a strong man or the man that fit your category. Meaning what? A strong man, it doesn't mean muscular and strong built. It means look into, if you're interested in females, for example, then look into the man genetics, the history of his family. You ask the boy or the man, listen, how many brothers do you have? Oh, I have 10 brothers. You have any sisters? No. So that's the man that's the man that will not, less likely to bring you a female, because his father only has his generations are males. His grandfather, males. His grandfather, males. So what are the chances this man will give you a female? Less likely, zero, maybe none. Okay, so now we look at the history of the family. We look at the the other possibility. You're looking for males or females. You just follow the genetic. Your father, how many brothers he had, how many sisters he got, and if this is your interest, this is how you're gonna base your evaluation on. So then you look into the family history of the genetic history of the family. So a family that has all the men producing males, most likely you will have a male from that man you're getting married to, assuming that the biological fathers, the biological mothers and the fathers are the same. Don't tell me about stepfather, stepsister. No, talking about the biological, the real father, the real mother. If all their offspring is males, the chances are you will have a male as a child. If the family, talking about the father family, okay, because here we're talking about the male. The male is the only factor that determines whether you will have a male or a female. Remember, as a female, you only have an X. You have a couple of X's there. There is no variation there. But the male is the one with the variation. He has the X and he has the Y. So tracing the family of the man will give you an understanding and estimate your chances of having a male or a female. To me, a male or a female is the same. Whatever God gives, we should thank Him for. We just blame possibilities, we blame statistical values to count, because everything is about the genetics. You don't have a say in whether you're going to get a male or a female. He does not have a say whether he gets male or a female. It's all about the genetics and the family history, the genetic family history of the family. I cannot take questions. Don't call. Please, for more than 6 months. Okay, that's another question. Please, for more than 6 months, I have not seen my period. I am not pregnant. Possible? What is the possibilities here? Possible if she is, well, she didn't say her age, but we have seen a lot of premature meaning before time, premature ovarian failure. Her ovaries have failed before time. The best thing is we'll look with ultrasound, see if there is any follicles in the ovaries. Then we'll run some hormonal tests, and then we'll confirm the diagnosis, okay? So this is early ovarian failure. If you have ovarian failure, that means the estrogen and the hormones that induce ovulation are no longer coming from the ovaries. As a result, you will not be able to ovulate, and that is what we call premature, meaning before time. ovarian failure. It can happen at 33, 34, even 40. You know, it can happen at early age. So why? Because menopause usually is about 50. Okay, 50 years old. So it can happen at 32, 35, but it can happen. We've seen cases like that, and it's not common. It's there, it's out there, it happens. Okay, so I think we covered enough questions. Let's start now our show today, and we'll please play the first video so we can discuss about what we've seen.
Yeah, I came here because of my testicles and growing of breast issue. So about some years back, I had swollen testes, and I went to the hospital. They gave me some injections to take.
When was that?
About is it 2000 and 2016, like that?
Right.
Yes. Yeah. So I went to the hospital. They gave me the injection. After taking the injection, I realized the testes become strong. Then later start decreasing. Yeah.
The testes became stronger, but the pain was gone.
The pain was gone.
And
then as times goes, everything just disappears like that.
Yeah. And you lose desire for women.
Desire for women. Breast. Yeah.
And the breast is still growing.
Breast.
Yeah, let me see. Yeah. All right. Remove your clothes and let me.
Yes, sorry about that. So we see, okay, we see. Yeah. So now play the subsequent video also, please, because let's finish with ultrasound investigation and everything. Play the subsequent video, the next video as well, because it's all related to the same case. Play the next video, please.
No video. All right. So now here is the we look in this patient with gynecomastia is basically a big breast in a male. So we're looking at the testicles here, and I don't see no testicles. So how you explain no testicles here? Do you have any idea? What happened to your testicles?
I don't have any idea.
So you had testicles before?
Yeah.
When is the last time you were sure you had testicles?
Was years back.
How many years back?
About 6, 7.
6, 7 years? You
Yes.
sure you had testicles?
Yes.
How did you know that you have testicles?
I was okay.
Huh?
I was very okay.
Sure, but no face. Okay, so here is the testicles, and there is no testicles here.
Scrotum.
The scrotum is empty. The scrotum is empty here. There is no testicles. Okay, there is no testicles here, and that is why we have the absence of testosterone equal the absence of sexual desire. You know, and this is gonna also have a negative effect on the bones in the long run. And all the androgen that is coming from the adrenal gland is being converted into estrogen by the liver, and that is the reason we have the gynecomastia. So that's a case that needs to be investigated, but the mystery is, you know, I don't know. The patient said after the injection he had testicles before, after he taken that.
Is there?
Yeah, what did the neurologist tell you?
He just told me it's like they have to just investigate. I've been going there.
Investigate what?
Investigate me.
Okay, so what did they give you? What investigation have you
They
done?
did not give me anything. I asked that are they going to just leave me like this, and they told me I will be coming time to time so they can see.
See what?
That was all.
See what the testicles will come back or how?
Yes, because I asked.
You asked what?
I asked that am I going to be okay?
Yeah,
He
and they
told
say
me
what?
that yes, I'm going to be okay.
Yeah. Okay, you're going to be okay? That's what they tell you?
Yes.
Okay.
But I think I'm disturbing.
Did they tell you like your testicles never descended or something or no?
No.
So I'm trying to search in the scrotum to...
We're trying to search now in the inguinal area. Sometimes the testes never descend, but this is really mysterious. I don't see nothing in the inguinal area. There is no testicles in the abdomen. You know, this is really something that is very strange, because, yeah, this is a blood vessel there. This is a blood vessel. You see, if you put the color, this is a big blood vessel there, okay? This is even, I can tell if it's arterial vein, we can put just a pulsation there, and then we calculate, and this looks like an artery, okay? This looks like an artery. So yeah, so
I was trying to stream to the Facebook page, but it seems like, it seems like it's not going. We have technical difficulties, but anyway, next time we'll share to the Facebook anyhow. So now let me focus now on this page, and please no phone calls. I cannot answer. I will take the questions, WhatsApp the questions to me, send it by messages, and I will be more than happy to answer them. Now, we have seen the misery that, with this case is a very sad case, okay? So to summarize the case for you, in case we have difficulty with the audio, this is a young man, healthy young man, that at one day, 6 years ago, he has testicular pain and swelling, went somewhere, we're not gonna say where, and the doctor there, I don't know if it's a doctor or a nurse or medical personnel or not a medical personnel, they given him an injection. He said it was a hospital, but anyhow, we're not interested in that. We're interested in exposing the problem, saying what is the mistake that has taken place, and try to avoid the mistake. This is the learn. This session is about, patient education, and underline that 1,000 lines. It's about your education out there, okay? There is no benefits for me, and I'm not here to promote myself, promote anybody, or de-promote anyone. I am here to give you education about the mistakes that has been done. Those people were nice enough to share with us their experience and what they have gone through. And it's our job now to educate you so you don't fall into the same thing and the same thing don't happen to you. You see in the big breasts of a man, that's a man that is in his 20s, okay? And that is, he felt pain, and then his testicles were swelling. He went someplace and he got injection. And he was told to come every day for an injection. He was given the same injection repeatedly. Unfortunately, he doesn't have the name of the injection, neither the name of the person that gave him the injection. And, he doesn't have any information, nothing. He doesn't know where it was, like you have heard. So now, after he was given the injection, the testicle became hard. And as you heard from the video, before he was absolutely normal. He has sexual desire. He has intercourse with a woman, and he had a normal life. So after this, the testicle became hard, and then upon follow-up, he takes the same injection till the testis, as you see in the ultrasound, when I did the ultrasound, was no testicular tissues. No, it was not even a prostate there. Was nothing. Nothing then belongs to a male. We checked up in the abdomen, maybe the testicle have not descended, or maybe something mysterious has taken place. We could not find anything. Sometimes there is a disorder that happened, the man or the patient will have a male and a female at the same time, systems, but he doesn't. He's strictly a man. I asked him what about his gender. I mean, you feel like you're a man? He says, yes, I'm a man and I feel like I'm a man. But the problem is I don't have the sexual desire. And that is because the vanishing of the testicles. Because the testicles is the place that you make testosterone. And testosterone is responsible for sexual desire. So if you no longer have sexual desire, that means you have lost testosterone. And that is what the ultrasound show. There is no testicular tissue. So what is that mysterious injection that was given that make the testes, yeah, you made the pain go away, but as well as the testes. So what is that injection? Most likely, from the medical point of view, most likely that injection was high-dose corticosteroids. High-dose corticosteroids that was given by somebody who did not calculate the side effects and calculate the outcome very well. And the patient paid a heavy price. Now, is there any hope for this guy? Now, you see in the breast, how the breast came like that. Because if you don't have testosterone, we have another some enzyme in the liver that convert those androgen, now it became more, they convert those androgen coming from the adrenal glands, that is the only source that has been left already, into estrogen, and estrogen promote the breasts. So just like a female, what is responsible for the breast growth in a girl or in a female is the estrogen that is coming from, we have the adrenal glands, small, and we have the ovaries bringing more. So this guy now becoming, it's too much estrogen that has been converted by the liver into the estrone that is responsible for the breast growth. The breast is big and is very, now can we reduce the breast? It's possible. Can he get his sexual desire back? Yes, because simply, we have lost the testicles, that is producing testosterone, responsible for sexual desire, and also this man will have what is called as osteoporosis, which is weak bones. As time progresses, his bones will become weak. So we need to give him what he was missing. We need to give him the hormones. It has to be calculated, of course. You're not going to go out there to the quarter and ask for testosterone. It doesn't work like that. You have to be under medical supervision, good medical supervision. So that is his case, okay? And I thank him for sharing his case with us, even though the identity is hidden. But I thank him very much anyway. Now, there is not much to talk about in this case, except we will be talking about erection difficulties or disorder, or what we call in medicine erectile dysfunction. And we're going to be talking about PME, or premature ejaculation. This is I have a lot of questions, even though we have gotten to it. We have not gotten to it yet, but it all falls under infertility, because this is now the only factor a male can give is the sperm. So now, if you cannot have an erection and maintain the erection, obviously you will fail to ejaculate. Plus the headache and the difficulty you will cause the female partner. We will talk about this hopefully in the next session or so, and we're going to expose a lot of things, a lot of options that you can take care, and it will be very successful to you, and it will help you a lot. But this is not this session. Let's play the next video. Because we very much running out of time. Let's play the next video and let's check the information together.
2 years now. I've been having itches in my face, only my face, the same one and the same spot. Then after sometimes it used to swell. It used to be on and off. I've taken so many medication, Bio, Archer, many other medication for 2 years and no solution.
Okay, so what did they tell you was the problem?
Fungi, filaria. I've taken all drugs for fungi, filaria, nothing.
Okay.
Every medical treatment, nothing.
Okay, they send you to the lab?
Yes, send me to the lab.
Several times they could not understand what the problem was?
Yes.
Okay.
Now, let's look at this eye. You see the eyes? You see the lesions around the eye? It's been for 2 years. So the eye is swelling and we have those lesions around the eye. That's a problem. She was misdiagnosed for a long time, for 2 years, she said, and she was given painkiller because those lesions, when the eyes swell and those lesions come up, it's very painful. It's very painful. Especially, let me give you the story about those lesions. Those lesions are herpetic lesion. They call it HSV, herpes simplex virus, possibly with HPV, human papilloma virus. She was misdiagnosed. Whoever she went to, because she goes to the quarter, she doesn't go to a real hospital. She goes to the quarter, asks opinion for this, for that. She said a hospital, but they call a hospital that, that nurse that just graduated nursing school, they call this a hospital. So she has not been to a real doctor, otherwise she couldn't be missed. She couldn't be missed. Anyhow, this lady here, she has what is called herpes simplex. This is a lesion for herpes simplex, and it can become ocular. She has been having it for 2 years, and the mistake she has added to her condition is she's taking painkillers after painkillers after painkillers after painkillers. So when both eyes swell, we have to look at, this is my window to look at the kidneys. So we order a kidney test, and the creatinine was 3.7 or so. So that is high. That means the kidneys are not doing very well. The kidneys are not doing very well. So That is because of the repeated painkillers that she was taking. She was taking 3, 4, 5 times a day because the pain was there every time the lesion comes. So we put her in the right treatment. Hopefully she will recover, and we hopefully get the kidney to revive back. Once you stop the insulting medication to the kidney, the kidney most likely to come back, okay, most likely to come back. So we did some recommendation. We gave her some cream for the lesions on the eye, and hopefully she will rendezvous next week or so, and things will be much better. Let me see that next video. Yes, so that's another case. That is, as you can see, this is a swelling of the cheeks. Both cheeks is swelling, but this guy is smart because it has been swelling for the last 2 days or so. So he ran to the hospital and he's seeking diagnosis. Okay, you can take the picture away, and enough with me now. Take the picture away, please. So that is swollen cheeks. Okay, swollen cheeks. So that's a smart guy because it happened only last Wednesday. So, and he came to me yesterday or so. So, he was very smart. The pain was there, okay? The pain was there. The fever was there, the pain and the fever. And it's very nasty here. So it's right here at the jaw, not below. Below will be tonsils. Above here is the parotid gland. The parotid gland that is responsible for secreting saliva in your mouth, okay? So when this one is inflamed, it's bad. It's called parotiditis. Parotiditis, that means there is most likely a bacterial infection, a bad bacteria that has to be treated empirically. Empirically meaning we have to take severe action. We have to give a lot of strong antibiotics. Till when? Till the pain subsides, the fever goes away. Then we put the patient on oral antibiotics, and the patient will be fine. But the key is early intervention, because after that it can go shoot up to the brains. So that's an early case, and I thank him for taking care of himself, because he knows. Maybe he didn't know that this parotiditis, but at least he came to the doctor, okay? He didn't wait to take aspirin and diclofenac and go to the doctor wannabe in the quarters, the nurses. I'm nothing against nurses. I mean, I'm nothing without nurses, but I'm saying those who claim to know and instead, they do harm rather than good. When we were sworn in as medical professionals, we swore to do no harm. So keep this in mind. Do no harm. Do no harm is the only thing that we're looking for. Do no harm. Okay? If you do not know, refer. That's it. Before you do somebody some harm, because that's what you're being sworn for. Do no harm. That is the we swore in front of God. We do no harm, right? So this is what you should stick to. Let me see the next case, please. I don't know. Do I have a next one? Do we have another videos? I don't remember. I don't think so, right? Now, let me now talk about this 10 minutes to come about something that is very unique, okay? We have? All right, I don't think we do have another video, because the video we could not blur the identity of the child. So, we're gonna talk about this condition, and this is a condition for every woman with a child out there to be aware of. What is the condition? The condition called ADHD. ADHD is simply abbreviation for attention deficit. What is attention deficit? The child cannot focus. Let me describe the video. The child came into the office. He's running here, he's running there, he's grabbing my keys, he's touching my ultrasound, he's going to the nurse, take her pen from her pocket. He's all over the place. The child is 3 years old and cannot talk. And he's all over the place. He's all over the place. I'm talking about all over the place. He cannot stay in one spot for 1 second. He has to be doing something. And he cannot focus on if he goes there to start touching this key, now something else take his attention, then he goes to that something else. Something goes take his attention, he goes to that something else. So he's all over the place. He does not take a break. That is attention deficit, meaning he cannot focus. Attention deficit, hyperactivity. Hyperactivity, that's exactly like what the disease is. This is an exact description of the disease. Hyperactivity, he's everywhere. He cannot focus. Disorder, that's the last D. So that's attention deficit hyperactivity disorder. Now the question would be that's very common in children. and you get the history from the teacher, she will tell you, oh, his grades are dropping. He cannot stay still in one place. Maybe the first day, second day, he'll be fine because he's shy. He had not got used to the environment yet. But once he gets used to the environment, he cannot control that child. That child is going to be all over the place, up and down, here and there, everywhere, everywhere. So that's how he is. Is it? So what is the treatment? I get a stick and I start hitting him and beating him up and tell him stay quiet. It's not his fault. He is diseased. He has some abnormality, okay? Some abnormality in a brain cell. Is it bad? No, it's not bad. Could it be treated? Yes, it can easily be treated and taken care of. Attention deficit hyperactivity disorder. Before we used to call it attention deficit disorder, that's it. But now we have added to it hyperactivity because those children are always hyperactive, are always very energetic. They cannot take a break. So now, why he's not talking? That is, we call a small element of autism. I'm going to explain to you why. This child has a list of things to do in his head. Maybe 10 things that he has to do in his head at the same second. He has to touch the key. He has to take my phone. He has to go touch the nurse. He has to go to this ultrasound machine. He has to do, there is a list of things, okay, in his head that he has to do. And this is happening all the time. He doesn't take a break. So among the busy traffic in his head of the things that he needs to do, he will not pay attention to you, what are you saying, and say, yes, mommy, what can I do for you? No, because he's busy. He has a priority list, okay, 1, 2, 3. Actually, there is no priority list. I'm talking about there is a list, but he is confused which one to do first. Touch the key, touch the ultrasound, touch his mother, beat this, do that. He is confused which one thing to do first. That's why he is all over the place. So this guy, what he needs a manager in his brain to tell him this one should come first. You finish it, then go to number 2. You finish number 2, then go to number 3. He needs some manager in his head to tell him should be the priority. This is the second priority. Like, for example, you wake up your child, you wake up this child or a similar child in the morning. Okay, honey, time for school. Okay, what the child do after half an hour? He says, still sitting in the same position in bed. He has not moved. I mean, he's up. He woke up already, but he's still sitting in the bed. Half an hour later, he's still sitting in the bed. What are you doing? The child is confused. Should I wash my face first? Or should I brush my teeth? Or should I put on my socks? Or should I fix my bag? Or should I do this and do this and do this? So there's a lot of things going on in his head. And he's confused which one to start with first. So now we do give him the control. We give him the manager in his head so he can know, oh, I wash my face first, and then I put my clothes on, then I take my bag, then I go downstairs or go to the kitchen and eat something, then I go to the school bus and go to school. That is the normal list that he should have done. But he's missing the manager in his brain to tell him what to do. Now, the next question you will ask me, only children have this? The answer is no. You out there can have this, male or female, young or old. Yes, older people less likely because they grow out of it, but you still need medication. How is the example in an old man? And all those people are very intelligent. No? They're intelligent. An old man, for example, you know, on retirement. Right now he is on retirement, but you know, he's bored. You know, his life, he's becoming depressed. Why? Because those patients, I'm talking about the ADHD patient, okay, he will have to have something to do. Give him a couple of pieces of wood, he'll make you a cage. And he'll be very happy. Give him a broken car, he will fix it. You know, a broken TV, he will spend all his day and he will fix it. So those people are very intelligent when they focus on one thing at the time. When you focus on one thing at the time, you will master it, and they do it very well. They do it very well. When they master the case, when they master what they're supposed to be doing, when they master the case, they do it very well. So what they need? And there is no such a thing, oh, you'll be fine, you don't need medication. You need medication. Without medication, your life is difficult. You need medication, and that is the only way you can have a manager in your head telling you what to do first, what to do next, and those people are very intelligent. when they focus on one thing and one thing only, they do it very well. They do it very well. And remember, this is male, female, and children, but most commonly known in children, because those are the ones that manifest easily for us to see. Adult, they can mask the symptom with something else. Oh, put a smile here, put a laugh here, you wouldn't recognize. But if you live with somebody and you know this is how they are, this is attention deficit. This is attention deficit. The medication is very simple. And therapy, medication and therapy, especially for children. I got a lot of cases like that. So medication and therapy will bring the child back to normal. I don't know if we can take 1 minute break. Thank you very much for watching. My time is really up. There's only like few seconds remain. I want to thank you out there and have a beautiful and nice and safe weekend. And I will see you. I apologize for not able to take questions. I see the phone rings. I see like 25 missed calls. But please, if you see me now, and please send me the message on WhatsApp, and then I will be able to answer you either privately. And if you like to share your experience with us here on the show, you're more than welcome to do so. And I really appreciate you all. And thank you again for all the support messages I'm getting in social media and on TV and on the streets. And I thank you all. I love you all, and God bless you. Thank you very much, and have a beautiful and nice and safe weekend.